honest dialogue about past sexual experiences, present and past sexual transmitted infections, and last but certainly not least, HIV status. Whatever you decide, make it an informed decision and proceed with caution. Speaking of caution, let's discuss the types of barriers that are essential to safer oral sex. Most folks are familiar with non-lubricated male condoms for performing fellatio or giving head. And you should also know that you should use a new, non-expired condom fresh out of the pack each and every time you take on this task, right? Let's see the proper way to put on a condom. First, make sure that the penis is erect or hard.
Well, sometimes it doesn't take more than a look.
Hopefully not, because you really do want to avoid using your mouth or hands in order to avoid coming in contact with body fluids of things that you can't see. Next, you want to make sure that you gently open the package from the corner. Starting out with the ripped condom defeats the purpose of using it all together. Next, with the tip side up, place the condom onto the...
You know you can't show that.
Okay. So now you place the condom on the head of the penis and gently roll it down the shaft until you reach the base of the penis. If for any reason the condom doesn't go all the way down, try experimenting with different kinds until you find the one that's right for you. Every brand is not for every man. Condoms come in many different shapes and sizes, and the key to using them effectively is finding the one that's right for you. Experimenting to find the brand that is right for you could be a lot of fun.
Lots of people despise condoms for the use of oral sex, which is an understandable phenomenon. For those who refuse to use condoms for this purpose, understand you put yourself at risk for a variety of sexually transmissible infections. And never ever allow your partner to ejaculate in your mouth. Although pre-cum does contain pathogens and bacteria necessary for transmission of the infection, remember, be smart, be safe.
For cunnilingus, eating out, anal rimming, tossing salad, eating ass, whatever you call it, a fresh from the packaged dental dam is a necessity. These come in several different flavors, like strawberry, cherry, banana, you name it, for your licking or oral pleasure. The trick to providing maximum pleasure for the receiving partner with these things is to apply a small amount of water-based lubricant to the area about to be worked on prior to placing the dental dam on it. This makes for a much natural feel.
The same precaution, however, should be used whether you or your partner is HIV positive. Some type of barrier, preferably latex, should be used at all times. If you're allergic to latex, however, the female condom is a perfect alternative because it's made of polyurethane.
True. Germs and bacteria are always present. So even if you clean the area really well, you still will be proceeding at your own risk if you decide not to use a barrier.
Last but not least, there's penetrative sex, which, even with a barrier, is the most risky form of sex of all. In fact, receptive anal sex rates the highest in HIV and STI transmission rates due to the thinness of the tissue in that area. This is especially important for brothers who get down with other brothers to consider. Being in the receptive position opposed to the insertive rates a higher risk.
Actually, that should be taken into consideration for anyone who decides to engage in anal sex. And regardless of what you know or don't know about your partners, because you'll probably never know everything, we advise that you hold out at least until you find out you and your partner's HIV status. The more you know about safer sex practices, the better off you'll be in the long run. If you are unsure about anything that you heard here today, take some time to talk to your doctor or healthcare provider in a community-based organization in your neighborhood.
With that said, have fun, be smart, play safe, and always remember to
pause,
rewind, talk,
don't stop.